this concept that age matters, but we should really look beyond age. So yes, age matters. We know that nearly 80% of COVID deaths were in older adults, but at the same time, most older adults that had COVID survived, right? So age is not the whole story. And this brings up really some of the work we've done and others. We really saw that there were, gender differences, racial and ethnic disparity differences, people with comorbid conditions, baseline function and frailty, all these things really need to be taken into consideration. And I think a lot of the times, what we saw in Italy and a lot of places in the US that, built these algorithms of like who's going to survive and who doesn't. Everybody just puts age, right? Because it's the easiest thing to plug in, because nobody wants to assess somebody's baseline function and cognition and think about, some of the stuff that's not as easily captured. But that's the problem. You have to, like, it's, because age is just a number at the end of the day, and we have to learn to look beyond just age. So that's one important lesson. The other one is around like the atypical disease course of COVID, but also of all diseases in older adults, something we touched upon before. You can't wait for an older person to come in with your typical symptomatology. A UTI is not going to just be burning. COVID is not going to just be fever and cough. There's this whole other symptomatology that we need to look at that we call atypical symptoms, and we need to be really aware of them. This idea of weakness, of falls, of decreased appetite, fatigue, more confusion, those kinds of things. We really, as a healthcare system, we need to be aware that this is how older people are presenting. And again, this concept of delirium, this acute brain failure that really was pervasive during COVID. The other lesson learned really is about mobility, and the fact that we really, by socially distancing and by restricting visitations and by restricting people's ability to leave their space, we saw older people just lose their function, and so really being mindful of, like, yes, you're no doubt that we were trying to do the best by keeping family members out, and no doubt that we had good intentions by social distancing, but sometimes the social distancing caused more damage than, allowing for some flexibility. Sometimes the family member is imperative in the care of an older person, and so thinking maybe outside the box for the care of older people. And then there were some silver linings that we found. We did a study we published on social distancing, and other studies have found this also. Older people are really resilient in terms of like what they can withstand, because they have so much life experience. And so where, a lot of younger people were having, more anxiety and depression and were very hopeless during this time, older people were kind of like, okay, we can survive this, we can overcome this. And so really, not underestimating the resiliency of older people. And another important lesson, I think, that that needs to come out of this is death and dying, right? So during COVID, like, death and dying was really in our face. Like, people were dying, and I think this discussion and this topic came to light much more than usual, where, we're usually very scared to think about death, to really speak about it. If you think about all these like medical shows, everybody is, jumping and resuscitating, and everybody's kept alive, and that's not necessarily a good thing, and it's not that there's a black and white answer here, but I think being aware again of this concept of what matters most to the person, asking them before the emergent situation, like, what are your wishes? Would you want to live on machines? Would you want to, let's talk about the end. How do you want the end to look, before they're in your hospital about to get intubated? Like, these are conversations we should be having as families, as physicians, as primary care doctors, as social workers. Let's not be scared to talk about these situations, because if we don't talk about them, people end up not getting goal concordant care, right? And that's an important concept. So yeah, I think I can go on and on. I don't know. I mean, there's we learned about misinformation, and I think we had to do a lot of this was obviously is still a big issue and very overwhelming, but from drinking bleach to this is not a big deal, to the anti-vaxxers and this and that, and like how do we communicate? And it's not even about who's right and who's wrong. It's about, we clearly as a society don't do well in communicating information, and how do we combat the people that are the most radical speak the loudest, and how do you combat that when social media really pulls towards the most radical thoughts? And how do people get good, accurate information? And I think when you look at like a CDC website, does that really target the general population, or is that really targeted to me as a physician? How do we send the positive, the positive messages that we want to? How do we still maintain transparency? All these things are, I think, critical to think about of how we move forward, and how we, get people to have the correct information when they're making decisions. And so I think that's a really important lesson. Thinking about the use of telehealth, like we're doing now. Again, like telehealth is so powerful, and for an older person, like some of the people that I treat, leaving their house sometimes and going to a doctor's office, and then it's not just the PCP, then they have a nephrologist and a cardiologist and endocrinologist, and a visit like that could you need to coordinate with the daughter, and it becomes extremely overwhelming. And especially people that are maybe elder orphans, they don't have that much family, maybe people who don't have the resources to have the rides, and so how can we make medicine and healthcare more accessible, more equal to everybody else? I think that's a really important thing that we have to focus on in the future. How do you, as physicians, a lot of times we don't account for social determinants of health, right? We focus on the disease, the hypertension, the heart thing, but the way that person treats themselves or manages themselves is clearly dependent on where they live, their accessibility to rides, accessibility to medications, all those things. And so, thinking about diversity, equity, inclusion, those things are critical in moving forward.